One of the nation's best hospitals, Boston Children's Hospital, is now the first major pediatric hospital in the country to establish a gender surgery center. According to their website, the center currently offers vaginoplasty, metoidioplasty, phalloplasty, chest reconstruction, breast augmentation, facial harmonization, and other gender affirmation surgeries to eligible patients. All genital surgeries are only performed on patients 18 and up, but patients who want to pursue other surgeries could be as young as 15 if they meet eligibility requirements. To talk more about this, we are joined by Dr. Patrick Lappert, a plastic surgeon and member of the Catholic Medical Association, who's also a deacon in the Diocese of Birmingham. Doctor, nice to have you here.
Pleasure to be here with you.
So, Dr. Lappert, you can't just walk into this hospital and undergo one of those surgeries. There are several requirements, including letters from your doctor and your therapist, and you have to have been living full-time in your identified gender for at least 12 months. Even so, is 15 or even 18 old enough to make a decision like this?
Well, first of all, what's interesting about those ages of 15 and 18 is that Boston Children has already walked it back. When they initially announced this new transgender surgical services for children, they initially said that they would offer genital surgery like vaginoplasty, phalloplasty, those sorts of things, to 17-year-olds, and they also placed the chest surgery at a younger age than 15. It was 13, as I understand it. What is required to get referral for endocrine treatments or surgical treatments is a letter from a paraprofessional, a licensed social worker, a psychologist perhaps, and there's no test that any of those surgeons is going to offer the family that's going to prove or disprove that their child is a good candidate for the surgery. It's strictly a matter of opinion by the letter writer, and so it sounds like a lot of science going on here, but there really isn't a lot of science going on here.
The Catechism of the Catholic Church talks about sexual identity. It says, by creating the human being, man and woman, God gives personal dignity equally to the one and the other. Each of them, man and woman, should acknowledge and accept his sexual identity. So are these surgeries in line with the Church's teaching?
Not at all, because essentially what these surgeries are is an act of domination over the body and treating the body as if it's something separate from the person. You'll often hear the proponents of these interventions saying things like, the child felt as though they were born in the wrong body. So that's contrary to Catholic anthropology. We understand that the human person is a single nature. Body and soul together comprise the human nature, which is a singularity. Regardless of what you're proposing is wrong with the child, even if you're proposing that it could be corrected surgically, it would not be justifiable. And the claim that they make is that it's life-saving surgery is not supported by the evidence. There's nothing about this surgery that prevents suicide, prevents major depression, anxiety disorders, or any of the rest of it. It's strictly a cosmetic operation aimed at improving a subjective condition, which is never addressed.
Well, there is something on the hospital's website. It says it does support its patients' well-being, and it says, we are here to affirm, uplift, and advocate for transgender and gender-diverse youth, and we remain committed to doing all we can to support their care and well-being. As a plastic surgeon, don't you see that in your line of work, patients looking to improve their well-being through surgery?
Oh, I'm all about that. That's what I do. Reconstructive surgery, trauma, even cosmetic surgery improves well-being. Unfortunately, these surgeries that they are offering, as well as the medical interventions like puberty blocking and cross-sex hormones, have not been demonstrated in quality scientific evidence to be of any benefit to the child. They have the lowest grade of evidence to support these interventions, what we call level 4 and level 5 evidence. Not the kind of evidence that you make recommendations for things like irreversible surgery.
So I had a question. You mentioned this. Are these surgeries reversible? And if not, what are some possible complications from them?
Some of the surgeries are reversible. Okay. Some of the facial surgeries, one of the breast operations is reversible. Mastectomy on a 13, 14, 15-year-old girl is not reversible. All genital surgeries that are being offered are irreversible. What kind of complications can you have? Well, you will have lifetime sterility. You will have lifetime dependence on the medical system. You have all of the complications that attend large doses of sex hormones, including risk of heart disease, risk of what's called metabolic syndrome, diabetes. In fact, the puberty blockade now has a new warning that it has a significant risk of increasing pressure in the brain and causing blindness.
So what are some alternatives to these surgeries?
At the top of the list of things the child needs is family therapy, a look into what could possibly be going on in that child's life that perhaps they're misinterpreting. Cognitive behavioral therapy, proven benefit there. Historically, children with gender identity issues resolve them sometime in adolescence to young adulthood. Nearly 92% of people stop thinking in this cross-sex self-identification if you do the old-style treatment of watchful waiting, cognitive behavioral therapy, family therapy.
Deacon Patrick Lappert, plastic surgeon and member of the Catholic Medical Association. Thanks so much for joining us.
It's been a pleasure. Thanks for having me.
Hi, I'm Christine Persichetti, anchor of Currents News. If you like what you saw, please hit the like button on this video. And if you want to see more content just like it, subscribe and click on the bell for notifications. Thanks for watching, because we are putting your faith in the news.